Hi there, I'm Dr. Holly Hickman. I am a plastic surgeon at Ponte Vedra Plastic Surgery, and I'm going to talk to you about breast reduction today. So breast reduction candidates can be in two categories. It can be a cosmetic reduction for someone who just has kind of a little bit larger of a breast and is a tautic breast, which is a medical word for saggy, and we're trying to lift that and in combination do a little reduction. A medical reduction is when someone has what's called macromastia, which is a gigantic breast that causes shoulder grooving, pain, and it's deemed medically necessary by the insurance company. And you can only find out if you're medically necessary by the insurance company by looking at what's called your Schnur scale. And that's a scale that looks at your body surface area, which is a calculation based on your height and your weight. And the insurance company says, okay, if you can get off this amount of breast tissue and leave the patient with a normal breast, then she's a medically necessary breast reduction. So that's something that you can have assessed by your provider at the time of your consultation. So I like to use this drawing just to kind of show you the general procedure. So what happens is if this is a breast that was a little larger, there is a blood vessel. Let's make this red. There is a blood vessel that we preserve that goes to the nipple areolar complex. So we want to save that. It has its own blood supply that has to be preserved in order for your nipple to survive. And so what happens is when we do the breast reduction, I have to preserve all this tissue that's around that nipple areolar complex. I can take off the breast tissue that is anywhere around here, okay? So I could take a little bit from up here, I could take around underneath, but I have to preserve what we call this pedicle, which is a named blood supply. So once this is removed, you can see what the issue will be is moving this nipple up into this keyhole and moving this little pedicle up into here. So this yellow part that we're preserving with this blood vessel ends up getting accordioned up and becomes your new breast mound. So the nipple areolar complex is up here. This is let me undo that so you can see this a little better. This is skin flap 1 and that's skin flap 2. So once you push this breast tissue, so let's put this back on yellow. Once you take this mound of artery to your nipple areolar complex and you put that up here, so now you've got this breast mound. You move the nipple up here. You take skin flap 1 and 2, push this up and pull that around. So that becomes the top of your breast, now becomes the bottom of your breast. So what that ends up looking like on this next slide, so you can see, is an incision around the areole, down and under. And you can see that the nipple has been pushed up, the breast mound is now right here, and this is that skin flap 1 and 2 that's come around to make that breast reduction. And this is called a wise pattern breast reduction. This is the only procedure for a true breast reduction that we use. There's all kinds of different types of lifts that we do, but that's not for a breast reduction. So afterwards, the breasts tend to be a little boxy for a little while because we overlift them. So the bottom of the breast is flat. You've got this pretty big breast mound. And then over the next 3 to 6 months, it falls. They round out and become pretty gorgeous, well-handled breasts. So as far as recovery goes with this, I ask that patients have 2 weeks of no exercising, no sweating, and no heavy lifting greater than 10 pounds to let this surgical site relax. Can drive as soon as they're off their pain medicine, go to the store, go out to dinner, do things like that, just not a bunch of upper busy body work. So at the 3rd week, I let patients start working out, but just light workout, no upper body greater than 20 pounds until you get to your 6th week. So it's a very straightforward recovery, it's not hard. And then the incisions, finally, like we said, will be around the areola down and under. And if you'd like to hear more about breast reduction procedure, please look us up at pvps.com, and we look forward to hearing from you. Thank you so much.